Hello, this is Dr. Marty Klein. Today I'd like to talk about romance and spontaneity, which are usually not the best sexual goals. Joel and Marissa are very nice people. They care for each other and they plan to spend their lives together. Each of them has very little sexual experience, however, and they're having trouble getting into any sort of intimate rhythm together. They've come to me as a therapist while grappling with a perfect storm: very little sexual experience, very little knowledge about sex and bodies, and a lot of anxiety about sexual activity and competence. This would be enough to make sex difficult for anybody. Predictably, she's nervous that sex is going to hurt, and on the few times that they've tried intercourse, it's been very uncomfortable for her. He feels clumsy about this and he doesn't know quite what to do. Even if they asked each other a lot of questions, which neither of them feels comfortable doing, they couldn't give all the answers that the other one needs. They don't talk during sex. Nobody says, hey, slow down a bit, or move your fingers just a little bit to the left, or yeah, that feels good, keep doing it. They don't look at each other during sex. They feel self-conscious, they can't relax. I think they're afraid to see the anxiety in each other's face. So when they have sex, they feel miles apart from each other. And so they hardly ever do it. For the same reasons, they hardly ever cuddle. They hardly ever kiss. Maria's gynecologist sent the couple to me. He said, there's nothing wrong with me physically, she said. He says I need to learn to relax during sex, which the doctor said is your expertise. So the couple wants techniques, specific suggestions, proven methods. We'll do whatever you suggest, Marissa said warmly. Well, no one ever does whatever I suggest because inevitably I come up with things that people find challenging. Everyone who walks into therapy has already done whatever is comfortable. So we started by talking about their vision of sexuality. It was lovely in a simple way, but unrealistic. They dreamed of sex that was effortless, pleasant, predictable, no communication or planning necessary. Mostly, no problems. Passion was beyond their simple ambitions. And to make things more complicated, Marissa wanted the sex to be romantic and spontaneous. We're not looking for amazing, crazy sex, she assured me, thinking, I think, that the less they wanted, the easier it should be. I agreed that amazing, crazy sex was not our goal. But whatever I encouraged them to do, they didn't like it. Each week, I would propose simple, everyday activities. Brush her hair after she showered, hug him when you come home from work, and look at him for 3 seconds afterwards, 3 seconds. Select her earrings for the following day, stroke his arm at 3 or 4 different speeds and ask which one he likes best. These things are all too artificial, Joel said. It feels like doing homework. Well, yeah, it was homework, but we had discussed making such activities pleasant. So what could they do to relax while doing these things and to make them more enjoyable? That was actually a central part of the assignment. Repeatedly, they couldn't quite figure that out. Besides, she said during one session, this isn't sex. We're here to have more sex. At this rate, we'll never get to sex. Well, that was true in one sense. If they couldn't figure out how to relax and enjoy touching an arm, how to change into pajamas in front of each other, how to discuss birth control, it's unlikely that they would ever progress to sex, whatever that means. So we talked a little bit about their bodies. I used simple phrases like when she touches your penis, or when your vagina gets wet, or when you feel really excited. And they stiffened up each time I would say something like that. I asked, do you know whether or not she's had an orgasm with you? We don't use words like that, Joel said. Okay, I was agreeable. What words are you more comfortable with? And she said, is it really necessary to talk about this in this cold, clinical way? Well, what way would you like to talk about it? I asked. They were totally silent. And finally, well, she said, looking at the floor, I guess we don't talk about these things. Yeah, he agreed, playing up with a button on his shirt. We don't, discuss our bodies. It's a little yucky, don't you think? So they didn't want exercises. They didn't want to talk about sex with their bodies. They didn't want to deliberately touch each other while relaxing and enjoying it. That wouldn't be such a big problem if they already knew how to relax and enjoy sex, but they didn't. And the only way they felt comfortable talking about their situation was in the most vague and therefore unhelpful way. I asked what they enjoyed doing together outside of the bedroom, and they had talked about hiking and biking. Great. And what about in the evenings? They didn't watch TV together because they liked different shows. They ate dinner together most evenings, but apparently that typically involved looking at their phones when they ran out of conversation, usually about 10 minutes into the meal. I thought about this, imagining their lives as a couple, coexisting rather than entwined. In a friendly way, I shared my image of them. They were curious about what I meant, so I explained. You know, the phrase in the child development literature is parallel play. This is a stage at roughly 2.5, 3 years old when kids can actually play alongside each other, but not interact very much. They're watching and sometimes copying each other. They're listening and sometimes adjusting to each other, but they don't communicate directly with each other, although they're not totally ignoring each other either. They're parallel. And they actually agreed that, yeah, that described their relationship, although it hadn't occurred to them that this might be a negative thing. It isn't negative, I said, but there's a limit to how much 2, 3-year-olds can cooperate or manage conflict or share. Adult relationships, I said, adult relationships at this primitive level, they have predictable difficulties, like they have trouble creating what some people call romance because they haven't developed enough empathy and they don't imagine or pursue interactivity. Well, romance had been something that Marissa really wanted, but without understanding how it's usually contexted in other things like communication and cooperation. They both had also rejected sex dates or intimacy dates, saying that that's too artificial. They wanted sexual spontaneity, even though they rarely did anything else spontaneously, and certainly not as a couple. In a relationship based on parallel play, I explained, sexual spontaneity is almost impossible because it requires that people think in terms of cooperation, actively leading each other or initiating joint activities. Being professional tech people, like so many of my patients, they like this systems analysis, and they could see how this model, parallel play, explained their difficulties. In fact, Joel himself said, so when adults act like 3-year-olds, they shouldn't expect an adult experience, right? Well, I totally agreed with him, and she got it too. So I guess you would say that solving our sex problem involves things besides sex, she said. Absolutely, I replied. I do like working with smart people. And so instead of trying to solve their sex problems, we worked on getting them more involved in each other's lives. That involved learning to ask each other more questions, imagining ordinary features of each other's day, like what they had for lunch, taking responsibility for some of their free time each week and proposing a joint activity, periodically envisioning and discussing their future together, and definitely having dinner without any digital devices at the table. I gradually introduced some touching exercises into their homework. They felt awkward, of course. They skipped them sometimes, and sometimes they did them too earnestly, and eventually they were able to talk with each other about them. And one day they reported to their own surprise, enjoying a couple of these exercises. That was a grand day for us. And romance, spontaneity, well, we didn't get there the way that they thought we would, but we did get to places that they hadn't anticipated, which they actually did like. Communication, intimacy, honesty, and pleasure. They even made a play date together last week. It wasn't spontaneous, Marissa laughed, but we did spend time together undressed and playful with a light on and without phones. Well, with a light on and without phones, that's when I knew they were on their way. I'm Dr. Marty Klein. Thanks for joining me. And by the way, I publish one of these little video quickies every weekend, so if you want to hear about it, just subscribe using the red button below. Thanks.